Let's now go to the University of New South Wales Economics Professor Gigi Foster, joining me live from Sydney. Gigi, good to talk to you again. It's been great talking to you throughout the pandemic process and subsequently. You published books on the way this country handled it then. Give me your top-of-mind assessment of what we've learned from the report released yesterday.
We've learned that basically the lessons that should have been drawn from Australia's disastrous COVID response have not been drawn. We've learned that those who contributed, including myself, to this inquiry in good faith and giving as much evidence about the damage of these policies and the hopelessness of a centralized, control-based approach to handling a respiratory pandemic, we hoped that that evidence would go into forming a report that really saw the cracks in Australia's institutions that this COVID response has shown us. And unfortunately, we don't see that in the report. It's another papering over with some commentary about, yes, there's been a bit of damage from the lockdowns, which at least they did acknowledge that, and a lot of focus on particular subpopulations, but no recognition that the governmental actions are the main thing that cause damage. And if we have more government action next time and suppress the coalface freedom to experiment and move around and do all the stuff that we need to do in order to innovate our way out of a crisis, we will get more damage next time.
Yeah, this is the problem, isn't it? That they treat this as almost as an exercise in hindsight, that, looking back, we can see the states might have been a bit too tough. But, you know, all in all, we muddled through, and you have a Centre for Disease Control, you get more coordination. But the breaches of freedom, the overreach in terms of the response, the medical misinformation that was spread around, none of this is hindsight. We could all see that at the time. And I'm talking to you right throughout that process when it comes to the economy. Experts with high degrees of credibility like Professor Peter Collignon calling this out. And we need a proper inquiry that's going to be forensic so we don't go down this path again rather than go down it with an extra authority looking over us.
No, that's exactly right, Chris. And unfortunately, this is symptomatic of the Australian approach to economic problems. I mean, I've seen this and I've discussed this with you before on prior programs, that amongst the people on the street and amongst the government bureaucrats and politicians themselves, there's this mindset that if we have a problem, and in this case, we had a health crisis, if we have a problem, we have to look to government to work out what the solution is. And that consistency and coordination are good things in and of themselves, that somehow will promote more welfare, minimize harm, maximize health, etc. That's just not true. That's never been true. I mean, when you have a centralized, coordinated approach to running a system, well, that sounds like communism to me. That's a totalitarian-based, monovision-led kind of ideology. And we don't have that in Australia. We shouldn't have that if we really want the best for our people. We have creativity and innovation on the ground every day. And in a crisis particularly, we need to trust our people and unleash their power to discover what would work best to preserve health and heighten our security and calm the fear. And that's what the government did not do. It did not trust its people, its doctors. It did not tamp down the fear. It did not even treat people who had COVID with standard anti-flu sorts of remedies. It basically said, stay home and hope that you don't get bad enough to go to hospital. And it's just it's a really offensive way to treat people who are in fear and in bad health. And unfortunately, I don't see that this newest report is a step in the right direction. There's a little bit of recognition of some of the harms, but really just a big leap backwards in terms of advocating for more bureaucracy for next time, more surveillance, as you say, the Australian CDC, more coordination and more of what I think is just destined to produce more damage.
There's so many measures that bear out exactly what you say, but the one that always stands out to me is schools. There was never any medical advice or medical reasoning to close down schools, yet so many kids had their schooling destroyed and social problems are onflowing from that. And as you say, if we left the schools open, then individuals could have made choices. If they were at risk or they were worried about their kids, they could have stayed away, but the rest of society could have gone on with schooling as they always should have done. But the trouble is, even after this report comes out, listen to what the current Premier of Victoria's got to say.
The decisions that were taken during that 1 in 100 year pandemic, it was an unprecedented time. So we were taking all the measures we could in that context to protect lives and livelihoods, and that was absolutely part of that public health-led response.
You talk about governments trying to quell fears. All governments were trying to exacerbate fears, and I think the missing element from this report too is the media, because the media were hand in glove in heightening fears.
That's definitely true, and I do hold some hope for the development of independent media during this time. The backlash against the destructive government policies has fueled the sort of new shoots of media from independent podcasters and independent channels, which I think is a positive development for Australia. But unfortunately, many Australian citizens really are glued to mainstream sources. I mean, Sky is kind of in between those two, you know. I mean, I like your channel, obviously, but it's not quite as mainstream as, you know, maybe the ABC. And unfortunately, a lot of Australians really just get their news from one mainstream source. So they have really no idea that there is a completely different way to see what happened during COVID than the way that they're being fed by politicians who were in charge at the time.
No, you're exactly right. If that's all they get, their only source of news, they will have no idea of the reality. It's tragic. Thanks so much for joining us, Gigi. I appreciate it. Gigi Foster there, Professor in Economics at the University of New South Wales. She has been consistent and right on this stuff all the way through.